Brazilian President Jair Bolsonaro continues to dismiss the risk posed by the COVID-19 virus and calls for a return to normality. According to the World Health Organization, the US has the potential to become the new global epicenter of the coronavirus pandemic. A conference call was held between representatives of the Association of Caribbean States to exchange experiences on fighting COVID-19, while Venezuela has confirmed 91 cases. From the headquarters of Telesur English in Havana, Cuba, this is From the South. I'm Katrina Goss. Brazilian President Jair Bolsonaro continues to dismiss the risks posed by the COVID-19 virus and has called for the country to return to normal. In a national TV broadcast on Tuesday, Bolsonaro questioned school closures when the group thought to be most at risk is people aged over 60. The president also criticised moves by several state governors to declare quarantine measures to halt the spread of the virus, claiming there was hysteria over the pandemic and that life must go on. During his address on Tuesday night, people banged pots and pans in what has become a common form of protest in recent weeks to demand Bolsonaro's resignation for failing to adopt effective measures to contain the COVID-19 virus, which has so far cost the lives of 34 people in Brazil, while the number of confirmed cases is almost 1,900.
They are spreading fear, using the large number of deaths in Italy as the main vehicle, which is a country with a high number of old people and with a completely different climate to ours. A perfect scenario supported by the media to create true hysteria that is spreading in our country. However, since yesterday, a section of the press has changed its position calling for calm, and that is great news. Congratulations to the Brazilian press, and may balance and the truth prevail amongst us. The virus arrived, it is being tackled by us, and it will soon be gone. Life must go on.
Following a regional strategy for joint coordination in the face of the COVID-19 pandemic, Venezuelan Foreign Minister Jorge Arreaza reported that a video conference was held with government representatives of several Caribbean countries. The conference call offered a space to exchange experiences and protocols given the spread of the novel coronavirus in the region, and saw the participation of foreign and health ministers from the Association of Caribbean States.
It is very important for us to share the experience of the social quarantine, which is the first in Latin America, a preventive quarantine that has now been imposed across all the national territory. Some countries commented on it as an interesting experience to be reviewed, to see if it can be repeated in their countries. And well, we are open to sharing these spaces and future spaces, our progress and our initiatives.
Venezuelan President Nicolas Maduro offered an assessment of the quarantine plan implemented in the country for the past week to combat the novel coronavirus. Maduro reported 7 new COVID-19 cases, bringing the total in Venezuela to 91. The president explained that the states with the highest numbers of cases are Miranda State with 39, the Capital District with 14, La Guaira with 9, Lara State with 4, Barinas and Los Roques with 3 each, and Anzoátegui, Apure and Falcón states with 2 cases each. Every state of the country now has at least 1 case. Maduro also reported that 15 patients have recovered from the virus, while calling on the population to remain united to combat the epidemic. Chile's Chamber of Deputies approved a new electoral calendar this Tuesday that postpones the referendum on a new constitution from April 26 to October 25 due to the novel coronavirus outbreak. The approval will also affect the municipal elections, which will now be scheduled for April 11, 2021, as well as the election of constituent assembly members. The postponement of the referendum had already been announced, but right-wing sectors in the chamber had sought to avoid setting a new date. Parliamentarian for the left-wing Social Convergence Party, Gabriel Boric, stated that although the priority is health, this does not mean that the problems that Chile has been experiencing since before the pandemic can be swept under the carpet. Experts estimate that the peak of the epidemic in Chile could occur in the next 8 to 12 weeks. And the Chilean Ministry of Health announced an increase in COVID-19 cases on Tuesday, taking the total to 922. 176 new cases were reported in the last 24 hours, and all regions of the country have at least one confirmed case. The metropolitan region has the highest number of confirmed cases at 540, followed by Ñuble region with 105 cases and the Bio region with 73. President Sebastián Piñera declared a national state of catastrophe over the coronavirus outbreak on March 18th. Measures were established, including a national curfew from 10 p.m. to 5 a.m., the isolation of people aged over 80, restriction of movement, and a quarantine period for foreigners and Chileans arriving in the country. However, the population and opposition parties have stressed that the Chilean government continues to prioritize the economy over people's health. Recently, a group of mayors of various political parties addressed an open letter to the presidency and to Congress calling for a national quarantine to be imposed. Mexico reported 405 COVID-19 cases and 5 fatalities after announcing school closures until next month this Tuesday. Meanwhile, there are 1,219 suspected cases and over 2,000 patients have tested negative for the coronavirus. The Mexican government has banned events of more than 100 people and suspended some productive activities as it enters the second phase of its novel coronavirus prevention plan. The Mexican president noted that despite the economic crisis provoked by the pandemic, the country has strengths to face the challenges. The Mexican defense minister confirmed over 16,000 personnel will be deployed to combat the outbreak. Meanwhile, Deputy Health Minister Hugo López-Gatell explained during a press conference on Tuesday that Mexico has taken timely action, which has prevented the virus from rapidly spreading. The Congress of Guatemala ratified 2 governmental decrees this Tuesday that include a curfew and an extension of the state of calamity for another 30 days to face the COVID-19 epidemic. Also approved was a $200 million loan from the International Bank for Reconstruction and Development to address the emergency. The Congress also called to speed up the delivery of basic supplies, such as masks and thermometers, to the departmental health network. A resolution was approved to urge the government to partially or totally renegotiate the budget for the payment of foreign debt in order to reallocate funds for use in the health emergency. Meanwhile, President Alejandro Giammattei inaugurated a hospital set up in the capital to treat COVID-19 patients. He said the construction of the hospital in record time shows that Guatemala has the capacity to organize and respond to an event like the novel coronavirus. Guatemala has confirmed 21 COVID-19 cases and 1 fatality. The number of people infected by the COVID-19 virus in Puerto Rico has increased to 39. According to the director of the Coronavirus Medical Task Force, Dr. Segundo Rodriguez, the number of infected people could be higher. He stressed that people must stay home, noting that between 195 and 390 unidentified people are likely to be infected across the island and could infect others. Puerto Rico has so far confirmed 2 COVID-19 fatalities. An emergency field hospital was inaugurated in Crema, Italy this Tuesday, where members of a Cuban medical brigade will provide support to local hospitals. The brigade includes both doctors and nurses and arrived in Italy over the weekend to help contain the spread of the novel coronavirus in the European nation. Present at today's inauguration were local authorities and regional officials of Lombardy, the hardest hit region of the country. Lombardy is home to 46% of the more than 59,000 confirmed COVID-19 cases and 68% of the nearly 7,000 fatalities reported in the European nation. And Cuba's also sending a medical brigade to help fight the COVID-19 virus in Dominica. Prime Minister Roosevelt Skerrit took to Facebook to express his gratitude towards the Cuban people. In the post, the Prime Minister also issued strong advice to all individuals who have been quarantined over the last week to adhere to the guidelines and protocols provided, while the officials of the Ministry of Health continue to conduct surveillance and testing activities. The Cuban brigade consists of 25 nurses, 5 doctors and 4 lab technicians who will arrive in Dominica on Thursday. In Venezuela, teams of Cuban doctors are carrying out door-to-door surveys to identify possible COVID-19 cases. In the second week of the national quarantine decreed by the Venezuelan government, the brigades of Cuban health personnel are working to prevent the spread of the novel coronavirus among local communities. The doctors are following the route laid out by a massive online self-diagnosis survey known as the Patria platform, which is helping to identify people with possible COVID-19 symptoms. The preventative measures against COVID-19 adopted so far have identified a first group of about 21,000 suspected cases who will be visited by the Cuban health brigades to confirm diagnosis.
It is important that the community at least takes control and properly registers in the Patria system, because through the Patria system a complete response is being provided, a tracking program, and it is important that people, through their smartphones or computers, can update daily the symptoms that they may experience, so that in this case, with the accompaniment of the local party branch, the community council, the people's power bodies, and the doctors of the Cuban mission, we can identify any possible source of infection within the community.
And Venezuelan Foreign Minister Jorge Arreaza repeated condemnation of the criminal United States blockade against the country, which is preventing repatriation of Venezuelan citizens. Through his Twitter account, Arreaza stressed, "We denounce that the US is insisting on its air blockade against Venezuela and still refusing to authorize direct humanitarian flights by Conviasa or other airlines to bring back the more than 800 compatriots stranded in the US." More stories coming up after this short break, so don't go away. Welcome back. According to the World Health Organization, the United States has the potential to become the new global epicenter of the coronavirus pandemic. Over the past 24 hours, 85% of new COVID-19 cases were reported in Europe and the United States, according to WHO spokeswoman Margaret Harris. Of these, 40% were reported in the US. More than 46,000 cases and 530 deaths have been reported so far in the US, with more than 20,000 cases in New York State alone. The WHO spokeswoman noted on Tuesday that the US could soon see a surge in the number of cases comparable to that seen across Europe. Earlier, US President Donald Trump admitted his government was experiencing difficulties in securing life-saving medical equipment. And meanwhile, US President Donald Trump claimed the rise in the stock market and bipartisan work on Capitol Hill are good signs that the country is returning to normal amid the coronavirus pandemic. The statements came after Trump declared on Monday that social isolation measures applied in the country due to the COVID-19 outbreak could be relaxed in a matter of weeks, claiming that this cure could be worse than the disease itself. Trump's reassessment comes as the White House is encouraging lawmakers on Capitol Hill to pass a roughly $2 trillion stimulus package to ease the financial impact on Americans and hard-hit industries. The Dow Jones Industrial Average surged to its best day since 1933 as Congress and the White House neared a deal. Trump's enthusiasm for getting people back to work sets up a potential conflict with medical professionals, including many within his government, who have called for more social restrictions to slow the spread of the virus. New York Governor Andrew Cuomo warned that his state's hospital system will soon hit a breaking point, resulting in avoidable deaths. And after weeks of uncertainty amid the COVID-19 pandemic, it has been agreed that the Tokyo 2020 Olympic Games will be delayed until the summer of 2021 at the latest. The news comes after Japanese Prime Minister Shinzo Abe and the President of the International Olympic Committee, Thomas Bach, held a conference call on Tuesday morning, where it was agreed that the best route forward was to postpone the Games. In a joint statement, the Tokyo 2020 organisers and the IOC said that the move sought to safeguard the health of athletes, everybody involved in the Olympic Games and the international community. This is the first time in their 124-year modern history that the Games will be postponed during peacetime. And our sports reporter in Quito, Jose Daniel Lopez, brings us more details on the impact of the COVID-19 pandemic on the sporting world.
The coronavirus pandemic has hit the biggest sporting event in the world, the Summer Olympics. Japanese Prime Minister Shinzo Abe said he and the head of the International Olympic Committee agreed to delay the 2020 Olympics in Tokyo for about a year. The Games will take place no later than summer 2021, and the Paralympic Games had been scheduled for August 25th to September 6th. Tokyo had completed preparations when the virus started spreading into a worldwide pandemic. Despite insisting for months the Olympics will go ahead as planned, this week Abe said that a delay might be unavoidable if all the events cannot be held. The agreement followed a mountain of calls from around the world to cancel or postpone the games. And also due to the coronavirus outbreak in Europe, UEFA has decided to postpone the Champions League and Europa League finals without setting alternative dates. The two finals were originally set for May 30th in Istanbul for the Champions League and May 27th for the Europa League. The final of the Women's Champions League final, due to be held in Vienna, has also been postponed. That's all for now. Back to you guys in Havana.
Thank you so much, Jose. And moving on to other news, India has gone into lockdown for 21 days as the government announced stringent measures to suspend all but essential services to contain the COVID-19 outbreak. India has reported almost 500 cases and 9 deaths so far. The authorities announced a total lockdown in 80 districts, including the populated cities of New Delhi, Mumbai and Calcutta. However, residents in New Delhi appear to show little concern about the decision.
We can solve problems we meet. We have stockpiled all kinds of food, enough for us to eat during the 9 days of lockdown. Even if the city is shut down for a month, we are not afraid, because we can help each other. As long as the government makes the right decision and cracks down on black markets, there will not be a problem in our daily life.
Saudi Arabia announced on Tuesday that the number of confirmed COVID-19 cases in the country had jumped from 562 to 767, and there has been 1 fatality. A spokesman for the Saudi Health Ministry reported that half of those infected have arrived in the country from abroad. Saudi Arabia started a curfew on Monday from 7 p.m. to 6 a.m. Anyone violating the measures will face a fine of 10,000 Saudi riyals or $2,622. Second-time offenders will have to pay double. The World Health Organization put the number of COVID-19 cases in Africa at 1,396 on Monday, with the last known case reported in Mozambique. However, the figures for some countries do not appear to be up to date. For example, Nigeria is quoted as having 22 cases on the WHO tally, but has officially declared 30 confirmed cases. According to the WHO, there have been 40 deaths on the African continent. Nigeria, Gambia and Zimbabwe reported their first deaths on Monday. A total of 43 African countries have reported COVID-19 cases. Egypt, South Africa and Algeria have the largest numbers of confirmed cases, respectively. And we're taking one last break now, but stay with us for more. The Houthi movement has welcomed a call by United Nations Secretary General Antonio Guterres for a global ceasefire in the midst of the fight against the novel coronavirus pandemic. Mohammed Ali al-Houthi, president of Yemen's Supreme Revolutionary Committee, welcomed the call by the UN chief and called for attacks by the United States, Britain, Saudi Arabia and the United Arab Emirates and their allies against Yemen to cease. He added that the Houthi movement also seeks the lifting of a sea, land and air blockade imposed on Yemen by the Saudi regime and its coalition allies in early 2015 to facilitate the adoption of preventative measures against the coronavirus outbreak. The UN considers Yemen to be the world's largest humanitarian crisis, with 14 million people at risk of starvation and repeated outbreaks of deadly diseases like cholera. According to an Iraqi security source, the US plans to build a new military base in western Iraq for the deployment of Patriot missile systems to supposedly protect American troops from possible attacks by Iran. Karim Alawi, a member of the Iraqi Parliament's Security and Defense Committee, told local media that the US attempt to deploy Patriot missile systems in its bases in order to expand its combat capabilities is rejected and considered a violation of Iraqi sovereignty. The decision came after Iran's Islamic Revolution Guard Corps fired a number of ballistic missiles at the Ain al-Assad airbase on January 8th in retaliation for a US airstrike authorized by President Donald Trump that killed Iranian Major General Qasem Soleimani. At least 70 Nigerian soldiers were killed in an ambush on their convoy by jihadist fighters in the northeast of the country, according to military sources. Insurgents fired rocket-propelled grenades at a lorry carrying troops as it travelled close to Georgi village in Borno State on Monday, according to an unidentified military officer. So far, 70 bodies have been recovered, but the death toll is expected to be larger and a rescue operation is still underway. Meanwhile, several soldiers were injured and others were taken captive by the jihadists. A spokesman for the Nigerian army said he was unable to comment on the reported attack. The convoy had left the regional capital of Maiduguri to launch an offensive on a camp belonging to jihadists affiliated to the Islamic State in the area, according to a member of a government-backed militia fighting the insurgents. Legendary Cameroonian jazz saxophonist Manu Dibango has died at the age of 86 after contracting the coronavirus. The author of such hits as Soul Makossa is the first international celebrity to have been killed by the COVID-19 disease. According to his music publisher, Dibango passed away earlier this morning in a hospital in the Paris region. The saxophonist was one of the pioneers of Afro jazz and also fused funk with traditional Cameroonian music. His biggest hit, Soul Makossa, was the B-side of a song to support the Cameroon football team in the African Cup of Nations, but was picked up and popularized by New York DJs. And we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. And join us on social media, Facebook, Twitter and Instagram. For Telesur English, I'm Katrina Goss, and thank you for watching.